In a rare case of throat cancer, the first rare surgery was performed at All India Institute of Medical Sciences in Bhubaneswar, Odisha recently. Speaking on the same, Executive Director of All India Institute of Medical Sciences, Bhubaneswar, Dr. Ashutosh Biswas, on May 5th said that a rare case of throat cancer requiring extensive surgery was successfully performed, enabling the patient to perform her regular activities.
Yeah, so one lady, 25 years old, who came to AIIMS and after getting refused from the various hospital in Odisha because he was suffering from the cancer in the throat, and a lot of hospital refused because she came almost at the late stage, and a lot of she was unable to eat, unable to breathe almost, and difficulty in having all. So that time, going for the treatment is very challenging because it was affecting the whole voice box, food pipe, and windpipe. This is a very important area, and the surgery is the most important steps at that moment to give some therapeutic approach for that. And as we know, this cancer, adenocyst carcinoma, is a very rare cancer of the throat. It does not respond to chemotherapy, radiotherapy much. So surgery is the only answer, and that in this stage, let's say, it needs a surgery, a very extensive surgery, radical surgery to be needed to give really life to this patient. So unless there is no hope of living this. So as it was very challenging to go for a radical surgery by the team, ENT and the original GI surgery team, it was decided to reconstruct the intestine and then also windpipes and all. So it was a very big, extensive surgery because the intestine was taken out of the abdomen and taken to up to this, pulling that up, reconstructing the food pipe is a very challenging part, passing through the thorax near the heart and putting then and creating a artificial food pipe for eating. That is very important. So it was done, and windpipe also was created for taking easy breathing and all. And also there are other parts of the thyroid part and other normal tissue was taken. So it was a very extensive surgery was done by a surgeon. And finally, it was a long surgery, almost 13-14 hours, with the support of the other or anesthetic support and the team of ENT, gastrosurgery, and the nursing staff. Finally, the patient was successfully operated, and the most important thing challenging is the post-operative. The mortality is very high in these cases where the extensive surgery is conducted. So that's critical stage, ICU management, the team. So it was very challenging for everyone. So finally there was no infection, no critical, no complications during 6 weeks of our stay in the hospital in ICU. And we discharged patient, and regularly we are monitoring for close follow-up that patient. Patient is now eating well, talking almost, although there is difficulty because the voice box is operated, taken out, the food pipe and all, windpipe. She is eating well now. Maybe slightly problem she may have because this is not a normal food pipe because the other intestine part is put into that. So that will be adapted over time. So at this moment, she is free of complication, and great job done in the institute. Hopefully, we are ready to also serve this kind of very challenging surgery by the AIIMS Bhubaneswar.
News Desk, Kaumudy Global.